you describe Sanfilippo syndrome generally and the specific type that Sadie has?
So Sadie has Sanfilippo, which is also called mucopolysaccharidosis, and she has 3A. And the easiest way to describe Sanfilippo syndrome is it is like Alzheimer's, but in children. So they will progress normally for a few years of their life, and it's different for every kid. Every kid has a different mutation. So they'll progress normally, gain all of the skills, and then eventually they will plateau and start to lose those skills. Um, Usually, like memory and speech is the first to go. They also lose ability to walk, to feed themselves. They're usually wheelchair bound, sometimes bedridden, and the life expectancy is around 15 years old right now.
My sunshine, my only sunshine, you make me happy when stars are bright. You never know how much I love you.
Please don't
Take
my
my sadness.
my what?
I said that
My sunshine
I'm no way.
away.
So her body lacks an enzyme that breaks down these certain sugar molecules in her brain. So it builds up, and that buildup causes all of the damage throughout her body, not just in her brain, but also it builds up in the rest of her body, and it causes to have, eye problems, hearing problems. They have enlarged spleens and livers. Um, they have heart issues sometimes, and every kid doesn't have all of the symptoms and all of the issues, but that's kind of a general what happens with the kiddos.
And when was she diagnosed with Sanfilippo syndrome? At what age?
She was actually diagnosed at 3 months old, um, which is very, very rare for Sanfilippo. That's very young. Usually they're misdiagnosed with autism, ADHD, like developmental delays. And we actually got a very early diagnosis because on her dad's side of the family, we knew that there was another child with Sanfilippo, and I can't ever remember what cousin number it is. I think it's her dad's fifth or sixth cousin. So it's kind of a long way down the line. But we knew that it was in his side of the family. My side of the family, I had no idea. And for a kiddo to have Sanfilippo, both parents are carriers. So once Sadie was born, she had respiratory distress syndrome. She wasn't breathing well on her own. We were in the NICU for 73 days. She was having difficulty with feeding. She had a brain hemorrhage, which is not a normal thing for Sanfilippo kiddos, but that was just an extra thing for her. And there was really no rhyme or reason as to why she was having all these issues, because she was 37 and a half weeks, so technically a term pregnancy. So with knowing that it's in her dad's family, that was one of the things we kind of pushed for, and we're like, can we just test for this and rule it out, because we know it's in his family. And even with knowing that, the doctors still didn't think that what the issue she was having had anything to do with Sanfilippo syndrome. They still didn't think that's what it was. But we did still get her tested, and at 3 months old, she was a little over 3 months old when we got the confirmation that she had Sanfilippo.
Is it possible for the child to be diagnosed with Sanfilippo prenatally rather than postnatally?
Yes. So there are some families that, like, they have an older kiddo that gets diagnosed, and then maybe the mom is pregnant or becomes pregnant, and they want to make sure that the kiddo doesn't have Sanfilippo. So there are ways to do it in utero. I'm not 100% sure how that all that's done, but I do know that there are ways to test in utero to see. And I know that it's been done, I don't know how many times, but I have seen a couple of people on social media that the kiddo gets diagnosed and the mom is either pregnant or she gets pregnant and they get testing done in utero.
In the past 2 years, you and your family appeared on SBS Kids, where she was able to communicate verbally. So she was able to produce particular words. Has there been any change in the way she communicates now? Is she able to still use those words, or is she relying more on nonverbal means such as body language, vocalizations, or gestures?
So since then she's lost most of her speech. She would probably be considered nonverbal because anytime she does talk, it's not a communicative talk. It's just kind of her saying random words, or it's not really her asking for things or telling us things. It's just she'll sing a song or she'll repeat something. So she still has words and she still knows words, but it's not a communication. And she still does, like, one of the biggest things she likes to do is sing songs. And so when we sing songs, she doesn't know the full songs anymore like she used to, but she will fill in sometimes. Some days, like on a bad day, it's just the last word of whatever the sentence is in the song. But some days she'll get to where on good days she can sing a line. But yeah, she's lost most of her words. She still does say mommy. But and I know that she's saying that to me because she's usually looking for me. But really, other than that, all of her words are just kind of random. Or if I say something like, are you hungry? She'll say hungry, but it's hard to tell if she's actually hungry or if she's just saying the word that I said. So it is a little difficult. She doesn't really like gesture things either. Usually, like if she's hungry or something, she just gets whiny and we have to take a guess at it. She does have an AAC device.
Mm-hmm.
She has the eye gaze device, and it's very cool, but I'm not 100% sure when she uses it if she's actually trying to tell us something or if she just sees something and she looks at it and then it repeats that word. So I'm not 100% sure still, even with the AAC device, that it's actually a way for her to communicate, if that makes sense.
What about her understanding or comprehension?
Sometimes it's kind of hard. It's kind of hard to know if she does or not, but sometimes I do feel like she does. Like if I tell her, if she picks up something she knows she's not supposed to have, and I say, Sadie, that's a no, she will like hand it to me, like she knows that she's not supposed to have it. So she starts to hand it to me. But other times it's kind of, I don't really know. I can't tell if she understands or not, and I just have to like take it from her because it's something she'll put in her mouth or something she's not supposed to have or something like that.
Mhm. And also, there was a video on YouTube of Sadie while she was able to communicate by using full complex sentences. And during that time, you said that she was still taking stem cell therapy, gene therapy, or enzyme replacement therapy for 2 years.
Placement.
So what was the exact therapy and how was its effects on her speech, language profile, or other cognitive skills?
So we got her diagnosed very young. So she was doing PT, speech, and OT literally since the NICU. So she's been having all of those therapies. So we got early intervention and all that stuff. So I do attribute that to helping her be farther advanced than most kiddos with Sanfilippo because we had that early diagnosis. And when she was younger, even before she started the enzyme replacement therapy, she was like talking up a storm. She had really complex sentences. She could communicate. She could tell you her wants and needs. Um, I mean, she was not technically caught up with the peers her age, but she was very close. And then she did start the enzyme replacement therapy at 3 years old. And it's kind of hard to tell how it changed, because you don't really know. For a Sanfilippo kid, they're all different. So you don't really know what her disease progression is going to be like. But she maintained and still kept gaining skills all throughout that time on the enzyme replacement therapy. And it was a phase 1 study. So it was not technically a drug yet. It just had like a bunch of numbers and letters for the name. But she was on that for 2 years, and clinically she was doing better. Like her heparin sulfate numbers were going down. So a lot of things were doing a lot better, and she was still maintaining and gaining skills, which is really big in Sanfilippo. But unfortunately, that pharmaceutical company had a bunch of changeover in their upper management, and they decided to divest that study and focus on different rare diseases. So we did get 2 years of it though, because they told us that they were stopping the study at about like 2 months in or something like that. So they did honor the consent form, and they did the full 2 years of treatment for all the kiddos. There were 6 kiddos in that study, and all of the kids stabilized, which is very big. Like they weren't losing skills. They all stabilized. Sadie was the only one that was actually still gaining and progressing, but they still decided to divest the study. So that was a big letdown. We contacted lots of other companies, people, just to see what our options were to try to get another company to buy the study, and nothing. It was too expensive to make and too hard to make, and it just didn't work out. So,
And also, I heard from, I think she's the coordinator of Sanfilippo organization, that although it requires, let's say, millions of dollars, maybe 15 or above, there will be very limited number of children who will be recruited, maybe 15. And Sanfilippo children, I think in the US is between 30 and 50. So maybe there's 50% chance that, let's say, Sadie will be one of those 15 children, right? And 50% chance she will not be. So it is still
it's hard. There's so many kids that are trying to get in so few studies. And it's not a known disease. So a lot of pharmaceutical companies don't focus on it because it's not going to treat as many people as some kind of other medication could.
Right.
She's making an appearance. Oh, you can't see. Say hey, Sadie. You say hello.
Hello, Sadie.
You say hello.
How are you?
Is that crazy? You say Sadie?
Hello.
Hey.
Hi, Sadie. How are you? Has Sadie ever had epileptic seizure? Yes or no?
She has had focal seizures. She is on medication for focal seizures, but she's never had like convulsive seizures.
And have you ever used or heard about medical cannabis?
Yes, and I know that is very big, especially for the kiddos that have the convulsive seizures. And a lot of times the Sanfilippo kids have pain, and you don't know what it's from. They're just kind of whiny, and they can't explain to you what it is. So I know a lot of families, when they get to that point, they do use medical cannabis for pain.
Have you ever used medical cannabis?
We haven't. It's not legal in North Carolina.
Mhm.
And she hasn't had any seizures that it would benefit from, and she hasn't been in the pain aspect of it. There is a clinical trial in California, I think, or it's supposed to be starting up, and it's for I think it's CBD. Um, I think it's a CBD study for kiddos with Sanfilippo, and I'm actually trying to get Sadie in it. I just don't know when it's going to start up, and they're kind of having some holdups on that. So, um, yeah, there's been some studies done. Um, so I think that's something that's going to be coming also to help
Mhm.
some of the symptoms that come along with Sanfilippo. So I do think that that's going to be something that happens in the next, I don't know, a couple of years, hopefully.
Explain Sadie's value to someone who struggles to recognize her contributions to the world.
So her contributions to the world are different than most people's, and that's it, everybody still has a contribution to the world. Her contribution is showing people the real meaning of life. She lives in this Sadie world, and it's happy all the time. And if more people lived in a world like that, it would be a better place. Our world would be amazing. Um, she just teaches you that, I mean, she's the most resilient kid, and she's been through so much in her short little life, but she still smiles, and she's still happy and giggly. And even through all of that, like, the world could really, everybody could learn something from her, even me as her mother, and I see it daily. Um, I sometimes have to be like, step back and be like, she's been through so much and she's happy. Like, this little thing that I'm going through is nothing compared to her.
Mhm.
And she teaches you that to live life to the fullest. Um, because we know her life expectancy is short, we have done that. We've tried to, get as much out of life as we can and give her as many experiences as we can. And I think that's something that a lot of people, um, when they get older, look back on and regret. And I feel like if you take a page out of Sadie's book, you don't have regrets. Not as many, at least.